So folks, here we have a 70-year-old male who has presented to the emergency department with gradually progressive left-sided weakness for 15 days. So remember here, patient has got focal deficit, but it is not sudden onset, right? So when you say it is not sudden onset, I would probably not think of an acute ischemic stroke. Also, probably I wouldn't think of an acute hemorrhagic stroke. Those two things are already out from my mind. Okay. Now, before this, the examiner tells us that he had head injury while down the road. So there is a history of head injury followed by that evolution of the focal deficits taking almost 15 days. So it has to be a chronic condition for sure. It is not an acute state. Okay. Examination shows hypertension and papilledema. When you say papilledema in the context of focal deficits, I would think of cerebral edema. Okay. Given the clinical features, what is your provisional diagnosis? See, remember here, it is head injury followed by that development of focal neurological deficits. Okay. And this focal deficits have taken around 15 days for the evolution. Okay. So can it be acute subdural hematoma? No. Okay. Can it be acute subarachnoid hemorrhage? Acute subarachnoid hemorrhage patients will be like, this is the worst headache of my life, doctor. I'm dying with headache. I cannot survive this. Please save me. That's how they present, right? Very, very severe headache. And often on examination, they will have signs of meningeal irritation. None of that has been mentioned in this question. So option C is not my answer. Okay. Acute extradural hematoma? No. Acute extradural hematoma can present with slightly delayed onset focal deficits, but not taking over 15 days. So what answer we can choose over here is obviously option B, chronic subdural hematoma. Chronic subdural hematoma can present like this. So when he sustained head injury, the bleeding started in the subdural space, but for the sufficient sized hematoma to develop and cause the compression of the adjacent brain parenchyma and lead to focal deficit is that taken quite some time. So that is why it is a case of chronic subdural hematoma. That's it over here. I hope that helped you. Thank you.